Chapter 22, Methods and Drugs Employed for the Local Treatment of Urethritis. Local treatment of the urethra is administered in the following ways: injection with small piston syringe, forced irrigation with piston syringe, forced irrigation with wall tank, catheter irrigation, installation of fluids, installation of ointments, urethrostomic applications, rectal massage, rectal irrigation. Methods employed: preliminary. The patient should empty his bladder, if he can, immediately before any treatment is applied to the urethra. Injection. The instrument employed is a 2-dram glass or hard rubber syringe. The tip may be of soft rubber and should be blunt so as not to injure the urethral mucous membrane. The syringe is filled and its nozzle applied within the lips of the meatus. To accomplish this, these lips must be gently drawn apart, the nozzle inserted snugly between them, and the lips then carefully pressed against the syringe, while the injection is made by slowly depressing the piston. The pressure upon the meatus should be lateral, not from above downward. If the fluid is to be retained more than a moment, the syringe is withdrawn while the lateral pressure is continued. Excepting in the prophylaxis of gonorrhea, there is never any reason to prevent the solution from entering the bulbous urethra. No pressure should therefore be put upon the urethra at the penoscrotal angle. If gently and intelligently performed, the injection will never irritate the posterior urethra or the epididymis. In the first days of a gonorrhea, injections may be repeated as often as every 3 hours, thereafter not oftener than 3 or 4 times a day, and in chronic gonorrhea, not oftener than once or twice a day. Some patients can voluntarily relax the external sphincter and permit the injection to flow into the posterior urethra. This may be encouraged by massaging the urethra with one hand while holding the meatus with the other. But this practice is not without danger and should be employed only in chronic cases.